Have you ever wondered if a simple exercise, something you can do in just 3 minutes a day, could actually improve your erections, your stamina, even your bladder control? It sounds almost too easy, but this isn't a gimmick or a viral trick. It's physiology. It's the same way you can strengthen your heart. You can train the muscles that control your erections.
I'm Dr. Carolina, a urologist.
I'm Dr. Carolina.
I work
a
with men
urologist.
every day who
I
want to
work
feel
with men
strong,
every day
confident,
who want to feel
and capable
strong,
again.
confident,
But they've been told that the only answers are pills or surgery.
What I want you to know is that your body already has the tools. You just have to learn how to use them. And yes, it really does take only a few minutes a day.
It
As
really
men
does
get
take
older,
only a few minutes a
especially
day.
past 50
As
or
men
60,
get older,
erections
especially
often become
past
less
50 or
firm,
60,
and bladder
erections
control
often
often
become
become
less firm,
That doesn't mean
and
your
bladder
broken.
control can
It
slip a
means
little.
your circulation.
That doesn't mean you're
nerves
broken.
and pelvic floor
It means
muscles
your circulation,
aren't communicating as
nerves,
efficiently
and pelvic
as
floor
they
muscles
used to.
aren't
The most
communicating
common
as
culprits
efficiently
are the
as
same
they
ones
used
that
to.
affect your
The
heart.
most common
High blood
culprits
pressure
are the same ones that
diabetes,
affect your
stress,
heart.
even some
High
medications,
blood pressure,
all of them
diabetes,
reduce
blood
stress,
flow, and
even
nerve
some
sensitivity
medications
in the pelvic
all of them
region.
reduce
The
blood
good news
flow
is
and
that
nerve
blood
sensitivity
vessels and
in the
muscles
pelvic
respond
region.
beautifully
The good
to
news
targeted
is that blood
exercise,
vessels
and
and
that's
muscles
exactly what
respond
we're about to
beautifully
talk
to
about.
targeted exercise.
The pelvic floor
and
is
that's
a
exactly
sling
what
of
we're about to
muscles
talk
that
about.
supports your bladder,
The pelvic floor
bowel,
is a
and
sling
sexual
of
organs.
muscles that
It's
supports
the
your bladder,
foundation of
bowel,
male
and sexual
vitality.
organs.
When you
It's the
contract those
foundation
muscles,
of male
they
vitality.
press gently on the
When you
veins that
contract
drain
those
blood
muscles,
from the penis,
they press
trapping
gently
that
on
blood
the veins
inside
that drain
and
blood
keeping
from
the
the
erection
penis.
firm.
Trapping
When
that
those
blood
muscles are
inside
weak,
and
blood
keeping the
escapes
erection
too
firm.
soon and
When those
hardness
muscles are
fades.
weak,
When
blood
they're
escapes
strong,
too
they
soon
act
and
like a
hardness
natural pump,
fades.
increasing
When they're
blood
strong,
flow,
they
nerve
act like a natural
sensitivity,
pump
and control.
increasing
So
blood
this
flow,
isn't about
nerve
magically
sensitivity,
increasing
and
your
control.
size.
So
This
this isn't about
optimizing
magically
what
increasing
nature
your
gave you
size
and keeping
it's
it
about
performing at its
optimizing
best.
what nature
Now,
gave you
let
and
me
keeping
show
it
you what a
performing at its
proper
best.
3-minute pelvic
Let
floor
me
routine
show you
looks
what a
like.
proper
It's
3-minute
simple,
pelvic floor
safe,
routine
and you
looks
can
like.
do it anywhere.
It's simple,
at your desk,
safe, in your
and
car,
you can do it
even
anywhere.
while watching TV.
At your desk,
Start
in your
with
car,
the slow hold,
even while watching
gently
TV.
tighten the muscles you'd
Start
use
with
to
the
stop
slow
yourself
hold.
from urinating.
Gently tighten the
Don't
muscles
squeeze
you'd
your
use to
abs
stop
or
yourself
buttocks.
from urinating.
Focus deep
Don't
inside,
squeeze
a
your
lifting
abs or
sensation
buttocks.
rather than a
Focus
push.
deep inside,
Hold that
a
contraction
lifting
for 3 to
sensation
5
rather than a
seconds.
push.
Then
Hold
relax
that
completely
contraction
for
for
3 to 5
5
seconds.
Then
Breathe
relax
normally the
completely
whole
for
time.
another 3 to 5.
No straining,
Breathe
no
normally
holding
the
your
whole
breath.
time.
Repeat
No
10 to
straining,
12 times.
no holding your breath.
This builds
Repeat
endurance
10
and
to 12
control,
times.
the foundation of
This
steady
builds
erections
endurance
and bladder
control,
support.
the foundation
Next,
of steady
move
erections
to the quick flicks
and bladder support.
Tighten and
Next,
release rapidly.
move to the quick
1
flicks.
second on,
Tighten
1 second
and
off,
release rapidly
for about a minute.
1 second
These
on,
quick pulses
1 second
train
off,
reflex
for
speed.
about a minute.
The same
These quick
coordination
pulses
your body
train
uses
reflex
during
speed.
arousal. The same
Finally,
coordination
finish
your body
with the
uses during
endurance
arousal.
hold. Tighten
Finally,
those same muscles
finish
and
with the
hold them
endurance
for 10 to
hold.
15
Tighten
seconds.
those same muscles
Breathing
and
slowly,
hold them for 10
then
to 15
relax
seconds.
completely.
Breathing
Before the next
slowly,
round.
then
This
relax
longer
completely
hold builds
before
stamina
the next round.
and staying
This
power.
longer hold
That's
builds
it. 3
stamina,
minutes, 1
and
minute
staying
for each
power.
phase.
That's
the
it.
first
3
week you'll
minutes.
simply be learning
1
control.
minute for each
By
phase.
week 2
the
or
first
3,
week you'll simply
you'll
be
feel
learning
more connection
control.
to those deep
By week
muscles.
2 or 3,
By week 4,
you'll feel more
most
connection
men
to those
notice
deep
stronger
muscles.
morning erections.
By week 4,
better bladder
most men
control
notice
and
stronger
greater
morning
confidence.
erections.
Better
Now
bladder
let's
control
talk about
and
what's
greater
actually
confidence.
happening inside.
Now let's
when
talk
you
about what's
contract
actually
these
happening
muscles,
inside.
You increase
when
pressure
you
within the
contract
pelvic
these
veins,
muscles
and
you
force
increase
fresh
pressure within the
oxygen-rich
pelvic
blood
veins
into the
and
erectile
force
tissue.
fresh
Over time,
oxygen-rich
that
blood
improves
into the
vascular
erectile
tone
tissue
and elasticity.
Over time,
the
that
improved
improves
circulation
vascular
also
tone
helps
and
nerve
elasticity.
endings fire
The
more
improved
efficiently,
circulation
which
also
means
helps
heightened
nerve endings
sensitivity
fire
and
more
quicker
efficiently,
arousal,
which
not
means
a trick.
heightened
It's
sensitivity and
rehabilitation.
quicker arousal.
We use the
It's not a
exact same
trick.
principles
It's
in clinical
rehabilitation.
settings
We
to
use
help
the
men
exact
recover
same
from
principles
prostate
in clinical
surgery,
settings
or
to
treat
help men
premature
recover
ejaculation
from prostate surgery.
You're simply
or
doing
treat
a lighter
premature
preventive
ejaculation.
version.
But
You're
remember,
simply doing a
consistency
lighter
matters
preventive
more
version.
than intensity.
But remember,
Consistency
overdoing
matters
it can
more
cause
than
fatigue
intensity.
or tightness.
Overdoing
which
it
actually
can cause
worsens
fatigue
performance.
or tightness.
Which
Three focused
actually
minutes
worsens performance.
are plenty.
Quality
Focused
beats quantity.
minutes
Let's
are
clear up
plenty.
a few common
Quality
mistakes
beats
I
quantity.
see. Let's
Don't
clear
bear
up a few
down
common mistakes
like you're
I
pushing
see.
that
Don't
increases
bear
abdominal
down
pressure
like you're push
instead of lifting
that
the
increases
pelvic floor.
abdominal pressure.
Don't hold your
instead
breath.
of lifting the pelvic
Oxygen
floor.
is your ally
Don't
here.
hold your breath.
Don't tense your
Oxygen
thighs
is
or
your
buttocks.
ally here.
Isolate the
Don't
deep
tense your
muscles
thighs
only.
or
And don't
buttocks.
chase quick
Isolate
results
the deep
with
muscle
long
sessions.
sessions.
And don't chase
Like
quick
any
results
training,
with long
progress
sessions.
comes from repetition
Like
over
any
time.
training,
Here's what you
progress
can
comes from
expect
repetition
when you
over
get it
time.
right. Here's
Within
what you can
weeks,
expect.
you'll likely
when you
notice
get it
firmer,
right.
longer
Within
lasting
weeks,
erections.
you'll likely notice
stronger
firmer,
climax
longer
control,
lasting
and
erections,
reduced dribbling
stronger
after
climax
urination.
control.
Many
and
men
reduced dribbling
also report
after
fewer
urination.
nighttime trips to
Many
the
men
bathroom
also
and
report
improved
fewer nighttime
confidence
trips
and
into the
intimacy.
bathroom.
And because
improved
these same
confidence
muscles
and
stabilize
intimacy.
your pelvis,
and because
your
these
posture
same muscles
and
stabilize
core
your
strength
pelvis
improve too.
your posture
Now,
and core
a quick
strength
but
improve
important
too.
medical note.
Now,
Kegel
quick
style
but important
exercises
medical
are
note.
powerful.
Kegel
but they're
style
not a
exercises
cure-all.
are powerful.
If you're
but
experiencing
they're not a
persistent
cure-all.
erectile problems,
If you're experiencing
pelvic
persistent
pain, or
erectile
urinary
problems,
symptoms that
pelvic
don't
pain,
improve,
or
it's
urinary
essential to
symptoms
see a
that don't
doctor.
improve,
Those
it's
issues can
essential
signal
to
heart
see a
disease,
doctor.
diabetes,
Those issues can signal
hormonal
heart
imbalance,
disease,
diabetes,
prostate conditions
hormonal
that
imbalance,
need medical
or
evaluation.
prostate conditions.
Think of these
that need medical
exercises as part of your maintenance
Think of
plan.
these exercises
not
as
your
part
only
of your
treat.
maintenance plan.
For the best results,
not your only
combine
treat.
this
For
3-minute
the best
practice
results,
with habits
combine
that
this
support
3-minute
vascular
practice
health.
with habits
Eat a
that
balanced
support
diet
vascular
rich
health.
in vegetables.
Eat a balanced
berries,
diet rich
whole
in
grains
vegetables,
and healthy fats.
berries, whole
Do
grains
regular
and healthy
cardio
fats.
exercise,
Do
walking,
regular cardio
cycling,
exercise,
swimming,
walking,
anything that keeps
cycling,
your heart
swimming,
strong.
anything
Sleep
that
at
keeps
least
your heart
7
strong.
hours.
Sleep at
Manage
least 7
stress.
hours.
These things
Manage
raise
stress.
nitric oxide.
These things
Lower
raise
blood
nitric
pressure
oxide
and improve
lower
the very
blood
blood
pressure
flow your
and
pelvic
improve
muscles
the
are
very
trying
blood
to
flow
harness.
your
So
pelvic
here's your
muscles are
simple
trying to
daily
harness.
plan.
So
3
here's your
minutes of
simple
targeted
daily
pelvic
plan.
floor training,
3 minutes
a brisk
of targeted
walk,
pelvic
real
floor
food
training,
on your plate,
a brisk
plenty
walk,
of water,
real food
and
on your
consistent
plate,
sleep.
plenty of water.
Do that for
and
30
consistent
days,
sleep.
and you'll feel the
Do that
difference
for
not
30
just in
days,
your erections,
and you'll feel the
but in your
difference not
overall
just in your
energy and
erections,
mood.
but
If
in
you're
your
over
overall
60,
energy and mood.
this routine
If you're
becomes
over 60,
even more valuable.
This routine becomes
At that
even
age,
more
the
valuable.
pelvic floor muscles
At that
naturally
age, the
thin
pelvic
if
floor
they're not
muscles
used.
naturally thin
But the good
if they're
news
not
is that they
used.
respond
But the
quickly
good
when you
news
start
is that they
working
respond
them.
quickly
I've
when you
seen men
start
in their
working
70s
them.
regain
I've seen men in their
impressive
70s
and
regain
firmness
impressive
simply by
control
doing
and
these
firmness
exercises
simply by
faithfully.
doing these
It's never
exercises
too late to
faithfully.
train.
It's
Let's
never
pause
too
for a
late
second
to train.
and address
Let's pause for a
expectations.
second and address
This routine won't make you
expectations.
grow
This
inches
routine
overnight.
won't make you grow
It's not
inches
about chasing
overnight.
impossible
It's not about
promises.
chasing
It's about
impossible
maximizing
promises.
your
It's
natural
about maximizing your
What
natural
changes
performance.
is your function.
What changes
The quality
is
of your
function.
blood flow,
The quality
your ability
of your
to
blood
sustain
flow,
pressure,
your ability
and the
to sustain
reliability
pressure,
of your response.
and the reliability
That's what
of your
real
response.
confidence is built
That's
on.
what real
So
confidence
when
is
you
built
finish
on.
this video,
So when you finish this
don't
video,
overthink it.
Start
Don't
small.
overthink it.
Do one
Start
round
small.
of each step.
Do one
right
round of
now.
each step.
No one
right
will even
now.
know you're doing
No
it.
one will even
Set
know
a
you're
reminder
doing
on
it.
your phone.
Set
for
a
the
reminder
same
on
time
your
tomorrow.
phone.
Make
for
it
the
a
same
quiet
time
ritual.
tomorrow.
A moment of
Make it a
care
quiet
for your
ritual.
own body.
A
Because
moment
here's
of
the truth.
care
This is
for your
not
own
vanity.
body.
Erectile health
Because
is a
here's the
window
truth.
into overall
This is not
vascular
vanity.
health. The same
Erectile
arteries
health
that
is a
feed
window
the
into
penis
overall
feed the
vascular
heart
health.
and brain.
If
The
your
same
erections are
arteries that
weakening,
feed the
it's often
penis
an early warning
feed the
sign
heart
that
and
your
brain.
circulation needs
If your
attention.
erections are
When
weakening,
you strengthen
it's
this
often
system,
an early
you're
warning
protecting
sign that your
far more than
circulation
your
needs
sex
attention.
life.
You're
When
protecting
you
your
strengthen
longevity.
this system,
Take this
you're
seriously,
protecting
but
far
don't
more
be
than your
afraid of
sex
it. You're
life.
not
You're
broken.
protecting
You're
your
simply
longevity.
untrained.
Train
So take
and
this
you'll
seriously.
adapt. That's
but
how the
don't
human
be
body
afraid of it.
works. And if you
You're
remember
not
just
broken.
one thing
You're
from
simply
this video,
untrained.
let it
Train,
be this, and you'll
3
adapt.
minutes a day can change
That's how the
you
human
feel
body
about
works.
yourself.
And if you
Not
remember
because of
just one
magic,
thing from this
but
video,
because you took
let
control
it be
of
this,
something that
3
matters.
minutes a day can
If
change
this
how
helped
you
you,
feel about
give it
yourself.
a like, so it
Not
reaches
because
more
of
men
magic,
who need
but
real
because you
answers
took control
instead
of
of something
something
that
that
matters.
Subscribe for
If
straightforward,
this helped you,
science-based
give it a
advice
like,
about
so
men's
it reaches
health
more
and
men who
vitality,
need
and
real
share this with
answers
someone who
instead
might
of
be
false hope.
struggling. Quietly.
Subscribe
You could
for
give them a place
straightforward,
to start.
science-based
I'm Dr.
advice
Carolina,
about men's
your
health
health
and
your
vitality,
confidence, your
and
performance.
share this with someone
They're
who
all
might be
connected,
struggling
quietly.
and they're all trainable.
You could give
So
them a
start
place
today.
to start.
Take
I'm
3
Dr.
minutes.
Carolina.
You'll be
Your
amazed
health,
at what your
your
body can do
confidence,
when
your
you simply give
performance,
it the chance.
they're all